Welcome to the award-winning Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our mission is to educate, advocate, and inspire women in healthcare to lift as they rise. Each episode brings you voices of leaders who are breaking barriers and leading the way in advancing women's health. Join our global community of listeners as we hear from her. Ready to be part of the movement? Let's dive in.
When most people think about dermatology, they think about skincare products on a shelf or a routine in the bathroom sink. But the truth is, dermatology now sits at the intersection of biology, medicine, identity, and equity. It's about how we protect the body's largest organ and how disease manifests across diverse population and how science translates into confidence, health, and quality of life. Today's episode of Hear From Her is about the women shaping the future through research, clinical insight, and scientific leadership in dermatology. I am so honored to be joined by two extraordinary leaders whose work spans the full spectrum of modern dermatology. First, we have Dr. Hawa Dumbuya, who is a research scientist trained in cell biology and physiology with expertise in clinical research and skincare product innovation. After earning her PhD from Brown University studying UV-induced melanin synthesis, she went on to lead innovative clinical research at L'Oreal USA. Today, she heads the clinical research and medical affairs for La Roche-Posay US. And joining her is Dr. Zoe Diana Draelos, who is a board-certified dermatologist and one of the most influential figures in dermatology and cosmetic science today. With decades of experience across clinical practice, pharmaceutical research, and OTC innovation, Dr. Draelos has helped define how science and skincare intersect. Together, these two amazing women represent two generations of leadership, connected by curiosity, rigor, and a shared belief that dermatology is both deeply scientific and profoundly human. So, ladies, let's dive in. Uh, One of the things I wanted to ask you is when people hear about dermatology, they only often think about skincare. From your perspective, why is dermatology for you such a powerful and important scientific field?
Well, I think dermatology is a fun area because it's not just skin, it's hair, it's nails, it's the entire outside of the body. And if you think about it, dermatology encompasses who we project ourselves as to the world, but it also is how we want to be seen. It's our aspirations. It's defining as to who and what we are. And so dermatology really is a fun field of medicine because you can't see how bad your heart looks, but you can see how bad your skin looks. It's a very visual area. It's a very observational area. When you look at someone, you say, "Gosh, you don't look so well today." You're not assessing their liver, right? You're assessing their skin. And the other thing about dermatology that is really so much fun is it sits at the intersection between disease and health. And everybody has skin issues. Everybody is concerned about their skin. Everybody wants to project their best to the world around them. And that's what dermatology is all about. What do you think, Hawa?
No, very well said, Dr. Draelos. Everyone wants to feel good from the inside out and to feel seen, included, and represented. And I think dermatology is so powerful because it touches all of those dimensions at once, as Dr. Draelos just said.
And so I think just to kind of keep that conversation going, what first sparked your interest in science and dermatology? How did you even get into this field?
Yeah.
Tell us the story.
So this story, it starts from my parents. So my parents are originally from Sierra Leone, West Africa, and my brother and I were born and raised in France. And early on, I thought I will become a social worker because I really wanted to help people, especially families who have also immigrated to France like my own. When I was 15, my family and I moved to the US, and that completely changed my academic trajectory. I arrived during my sophomore year of high school, barely speaking English, and I was placed in English language learners classes. And by senior year, I had the opportunity to take an anatomy and physiology course taught by an incredible teacher, Mr. Wilson, shout out. And that class truly sparked my interest in the sciences and set me on the path to wanted to become a pediatrician. So that's really how I got interested in the sciences.
I think let's delve a little bit more into that because I think we all have a very common path.
Yes, I'm first generation American and my family is Greek.
Awesome. And so I think especially when you're coming into the US and you're learning the language Awa, there must have been a lot of difficulties for you finding your path there. But tell us about any other, challenges that you've faced in your path.
Yeah. So definitely language was the main barrier. And especially I was as a child, I was never too shy to speak up. But coming to the US, I remember as a teenager, I became a bit more quieter because I was not comfortable speaking the language. And I was also a bit ashamed of my accent. But despite the language, is not being familiar with the ways of living, or you don't know where things are, you don't know how to ask for help. Um, but I have to say, making friends, my family, they were tremendous support system that really helped make this adjustment to the US or to this American life more adjustable. But going to school really helped. Um, because with friends you get to speak up the language, you get to understand the way that they tend to live here in the US, because as a teenager I tended to compare a lot, this is my American life compared to my French life. But as over time you get to really get yourself familiar with the country, with the language and the culture, and it gets better over time.
Absolutely. And I think one of the things that's especially difficult for women right now who are interested in science is how do they even navigate that? And where do they go? And what are some of the career opportunities that exist? And so thank you both for being here to tell us more about this. I think it's going to be insightful for everyone who's thinking about science or medicine. So with that, Dr. Drills, turning it over to you. What originally led you to medicine and then eventually to dermatology? Tell us your story.
Well, my story is very, very circuitous. So, when I was in high school, I thought I wanted to be a musician. I was going to be a jazz saxophonist and I was going to be a classical clarinetist. And I actually went to Interlochen and the University of Michigan with that in mind. I love music. I always have a song in my head, even to this day. But I realized that I really loved the music, but I did not like to practice. So that was gonna be a real problem because being in a room by yourself playing music is a very introspective individual activity, and I am very people oriented. I like to be out and about with people. So I changed my mind and I decided I would be a mechanical engineer, which is a very logical segue. But I decided that I really like to see how things worked. So I went to school as a mechanical engineer, and during my senior year, I had to do a senior design project. And my design project was ultrasound machines because we were just introducing the first ultrasound machines looking at heart defects in children's hearts. So I was in pediatric cardiology. I was working on the thresholding circuits to help better understand what we were looking at with ultrasound and how to diagnose what we saw on the screen based on what the patient presented with. And I absolutely loved it. And I thought I was going to do biomedical engineering. It's absolutely great. I was set that direction. Then I realized on the flip side that it was really amazing how we could look at these children's hearts, figure out what was wrong, and figure out what was needed. But the flip side of that is those children had a very serious heart problem. They were not going to leave the hospital. They were not going to lead normal lives. They were not going to mature to adulthood. And then you have to go tell the parent, this lovely child is got a lifespan of about 3 months. And I just couldn't do that. That was I thought, "I'm an engineer. I cannot do that." So I realized that perhaps I needed to rethink exactly where I was going. So I applied to medical school, got into medical school. I was told, however, that engineers make horrible doctors because they can't relate to people. But that was actually why I left engineering, is because I missed people. So I went through medical school, the first 2 years are all book learning, that did great. 3rd year, you hit the wards. Well, my first rotation was psychiatry. So I worked at the Public Mental Health Institution. We don't have those anymore, but there used to be statewide. institutions for individuals who had emotional problems, and I love psychiatry. I thought, "This is so interesting, the human mind," and then I realized it's really interesting, but you can't do anything about it. So that sort of no, not gonna be a psychiatrist. Then my next rotation was gynecology. "Oh, this'll be great, women having babies." Nope, that was not good either because I got the honor of delivering dead babies because I was a high-risk triage, and that was I couldn't handle that either. Then I did radiology, and they stuck me in the basement. That was really interesting, a lot of machinery, a lot of equipment, but I do not like being in the dark. I'm a sunshine girl. So I walked through medicine thinking, "Oh my, I have made a huge mistake. I should have never applied to medical school. I should have stayed in engineering." I really have that engineering mindset. And now I'm into my 4th year thinking, "Oh no, I don't know what I'm gonna become. None of this has really worked out for me." And my first rotation my 4th year was dermatology. And I worked in a private physician's office, and people would come in, they'd say they have a horrible rash, and it wasn't there, so then I knew that they don't actually have a rash. None of these lab works or fancy evaluations, it's either you do or you don't. And then we looked at microscope slides, we did surgery, we were able to see kids, we were able to say older individuals, full life, male, female. It was great. The second day I decided, "This is it. I'm gonna be a dermatologist. This appeals to my personality, my need to be with people, my need to help people, my need to visualize because 'cause I'm a very visual person, everything I do." And since that day, I have absolutely loved dermatology. And I still love I go to work every day with a big smile on my face.
I love that story. I think what you just articulated is that it's okay to, keep trying different fields, especially if it's in medicine and different specialties until you find what you feel like is the right one for you. And honestly, I feel like from your story and what you just articulated, all the different rotations that you did equipped you to be a better dermatologist today. Because you learn so much about different aspects and different patient types, different aspects of care.
Oh, absolutely. My engineering I use every day too because there's a lot of mechanics that apply to skin, and we use lots of equipment to test skin, because skin is really a mechanics of materials, just like aluminum or copper. As a matter of fact, we basically model hair when we're doing hair studies, looking at similarly diameter copper or aluminum bars. So engineering really fit well into dermatology, and then it is a very people-oriented specialty, and I really love people.
And that's something that nothing will ever replace. I know now, obviously, we're in the age of AI, and that human connection, I feel, will still stay here, and people that can really elicit that and that are really good at that are going to continue to use technology to better their lives.
Yeah, the AI in medicine is an interesting topic because AI is only as good as the information on the internet.
Exactly.
AI is sort of a summary or culmination of whatever it can find. And so junk in, junk out. So it reads everything, right or wrong. It has no moral compass. It has no sense of what's good or bad information. And then it sort of puts it together and spits it out. So I think if you're looking for bad medicine, the place to go is AI. because because it has no judgment, and medicine of all areas requires a lot of judgment because you never have all the information, you never have all the answers. It's really intuition that leads you to that proper diagnosis or that proper medication recommendation.
Absolutely. And dermatology is at such an intersection between psychiatry, even when you think about it. So you really have to look at the patient, see what's on their skin, think about how it's making them feel, think about whether there's an underlying systemic condition that they're also dealing with, and it's very comprehensive in that way. And so I love dermatology as well.
Well, when a non-dermatologist looks at someone's skin and they call me up and they say, "I've got a patient with a red rash." Well, that's what AI would say. Well, every disease in dermatology is a red rash. You can't when someone calls me, "Well, what is it?" They have a red rash. Well, it could be about 3,000 things. Red rash doesn't tell you anything, but that's see, AI can't see either, and even if it could see, it would tell you red rash.
Absolutely. And so I'm curious, Awa, how did you get drawn into dermatology?
Yeah. So I tend to kind of follow up my story. I originally planned to become a medical doctor and major in pharmacology and toxicology in college, thinking it will make me more competitive for medical school. But towards the end of my sophomore year, I had the opportunity to learn the basics of cancer biology through a research internship under the great mentorship of Dr. Bacos at Mass General Hospital, and that experience was truly eye opening. I remember for the first time, I was able to propose and perform original experiments and to see them through or not without losing curiosity or ambition. And that process, trying to answer a scientific question by designing experiments to answer it, is what really ultimately inspired me to pursue a PhD instead of a medical doctorate degree in biomedical sciences. So after college, I go to graduate school, and although I initially planned to focus on cancer research, I chose an incredible research mentor, Dr. Wancha, as my thesis advisor, whose work centered on understanding skin pigmentation and skin color at the cellular level and molecular level. And that's how I found my way into skin biology research, and I've never left. Because towards the end of my PhD, I knew that I wanted the next step in my career to allow me to do translational work. Because as a trained cell biologist, I really felt that I was, as much as I enjoyed it, as much as I enjoy signaling, understanding cellular mechanism, I felt that I was losing track of the big picture, the people, the patients. So I knew that I needed my next step to allow me to do translational work where I can leverage my scientific expertise or my cell biology expertise, but still have an impact on people's lives. So I knew that I needed to leave academia and join the industry. And I joined L'Oreal, and this is how I found myself into skin research and in skincare product development, and now working for La Roche-Posay and oversee clinical research for a dermatological skincare brand. And that's how I got into dermatology.
I think that's fascinating on so many different levels. And the fact that you were able to navigate figuring out, I'm going to do my doctorate, I'm going to study cellular signaling, and then I'm going to help to apply that to skincare and eventually into industry. I think a lot of people, a lot of women, especially now, who are thinking about science may not be aware of so many different career paths that exists. So I would love, Awa, if you can expand a little bit and tell all the young women listening out there, what does your day-to-day life look like right now at La Roche-Posay?
Okay, so my official title is Director of Clinical Research and Medical Affairs. So I will say that today my role sits at the intersection of clinical research and scientific communication. And as part of a broader team, I help build and execute clinical strategies and ensure scientific rigor across studies supporting our product. And then I work on translating the data that we obtain from our clinical studies into meaningful insight that may inform clinical practice, educate our consumers, and patients' care around skin conditions and skincare products. You know, the best way that I could describe it, sometimes I'll say, when you watch TV and you hear clinically tested by, I'm the person behind, I'm the lady behind that term from an industry perspective. And I really love it because also a big part of my role is also collaborating across teams, from marketing to our research and innovation partners, as well as with dermatologists such as Dr. Draelos and external research organizations to ensure that the science that we do remains patient centered and clinically relevant, supporting our products.
It sounds like obviously an exciting role, and you are doing so much there. So, congrats on that. I do want to connect it with Dr. Draelos because that's how you met, right? Working in dermatology for La Roche Posay. I think turning it over to Dr. Draelos, a couple of questions. Okay, just curious about this whole paradigm of, OTC skincare, La Roche-Posay, why is it important for skincare products to be clinically researched and evidence-based? That's my first question. And then second, What innovations are you excited about most right now?
Well, there are a lot of skincare products out there, and there are products that can help your skin to heal and look its best. And then there are products that can cause skin disease. And so, Hawa is really vital in the whole process of vetting products to be sure they perform up to specifications, but also to be sure people enjoy using them, right? That they smell nice, they feel good on the skin, they're a pleasure to use. So, skincare encompasses not only the functional aspects of the product, but also the consumer experience as well. And that's why her medical and marketing kind of go hand in hand because a product can work great, but if it stinks and stains your face brown, that is not gonna provide the consumer experience that people are looking for. So, a good skincare product improves the skin, and that's where I come in. Many times, products are designed for people with sensitive skin. They have to be tested on sensitive skin to be sure they deliver. But then you also want to ask the consumer, was their skin smoother? Was their skin softer? Was there some tactile and visual cues that they felt when they used the product? And then we use instrumental analysis. We look at the water in the skin, the water coming out of the skin. We look at skin color. We enroll a wide variety of people because this product is meant for the population as a whole to be inclusive, male, female, all ethnicities. And then we take pictures so that we document our findings pictorially. So Hawa and I sort of work hand in hand. She conceives the product, she conceives the studies, and then I add the dermatology as to how to administer the study. And in the end, what that does is it allows L'Oreal to be one of the premier cosmetic companies in the world because when you buy a L'Oreal product, you know that it was tested, you know that there are people that stand behind it, and you know that it's going to perform. So there are several different levels required to have a good product. And, what good is making products if no one enjoys them and uses them? So the connection between dermatology and industry research and industry standards is very, very important.
Absolutely, and I think when especially you brought up an excellent point that makes me think that dermatology could be one of the most inclusive fields with respect to clinical research and clinical testing. Certainly, when we look at other fields, we still find disparities and even including women in clinical trials. But dermatology, and I think thanks to the likes of Awa and yourself, has really moved to or is really trying to move to a place where we have more inclusive representation from women, from diverse populations, because that's what our world looks like today. So I really commend you both on spearheading that.
Yeah, everybody's got skin. It may be a different color, a different texture, a different age. But, we'll study everything from children, all the way up to people in their 80s. Everyone in that segment needs skincare, but there are unique needs of skin, male versus female, young versus old, deeply pigmented, lightly pigmented. And so skincare products are specifically designed for a market segment that embodies that group. And that's why there's so many skincare products today on the market is there is something for everyone. And so I would have to say that yes, absolutely dermatology and skincare is one of the most inclusive categories in any store that you walk into, whether it be a Walgreens or whether it be a Target or whether it be the cosmetic counter at Bergdorf Goodman.
I agree. I agree. So tell our listeners a little bit about what innovations are you most excited about that you're perhaps studying today or that you know are coming out in skincare and dermatology. What should we be looking forward to?
Well, I think AI is going to play a big role in product development and formulation, and especially in areas like fragrance, where originally fragrances used to be derived from the actual plant material, and you would have to collect hundreds of thousands of flower petals to make a smell. Now you basically can synthesize that smell without depleting the supply of flowers because you have to have sustainability of the plant. And many plant ingredients are very important in skincare. They deliver actives to the skin, they deliver a smell, they can function as antioxidants and anti aging products. So, what AI can do is break down the components and even come up with fragrances that haven't been thought of before. So I think AI, from a chemistry standpoint, will be able to innovate because it can iterate so quickly, and that will provide fragrances that are sustainable, which is very important to respect the environment. Hava, what do you think?
Yeah, I completely agree with you. I think AI is really going to change the way that we do research, including clinical trials, perhaps, or the way that we recruit or find patients to enroll into our clinical trials to ensure that they are inclusive and diverse. Um, I'm trying to think of any other specific areas besides AI.
Right. Well, one thing I think that's happening is there are a lot of new ingredients being developed, and these new ingredients are more potent antioxidants. And oxidation is what causes aging. So I think we're gonna see a lot of development in the regenerative medicine, longevity medicine as it pertains to dermatology.
Absolutely. And I think about also right now with the anti-obesity medications and some of the impact of that has really spurred this new kind of development of skincare products that kind of help to mitigate some of the impacts of that. So I'm seeing that trend, but maybe that trend today is already old based on what you guys are talking about with AI and some newer ingredients that may be coming out. So I think the future is bright in dermatology, as they would say, and I think that it's an exciting field to be in as we're always trying to innovate and help patients, not just with their skin conditions and skin disease, but also with looking and feeling better. So I think one more question for our listeners, and I think this is a very important question because to everyone who's listening today, I think the key question is how can you help future leaders? Like, what advice would you offer to young women who are interested in dermatology or research or industry who are finding their place? Is there any advice that you could offer them on how to get into your field and follow a similar journey?
Yeah, I will say my advice will be to stay curious and persistent, but most importantly, surround yourself with a strong supportive system and to seek mentors who not only support you, but also challenge you, and stay in touch with them along the way. When I think about my journey, I had really teachers who became mentors, peers who became peer mentor, and it allowed me to navigate my path, identifying things that I really, really liked and things that I did not like. But ultimately, it just solidified the path forward. So I will definitely say stay curious, persist, but surround yourself with a strong supportive system so that they can carry you through along your journey.
Definitely, I agree, and I feel like one of our both support systems here is Dr. Draelos. So advice from your end, Dr. Draelos, to women who are trying to enter, dermatology as a medical profession or dermatologic research.
Well, dermatology, is an interesting field because there's so many different facets to it. You know, there's the aesthetic facet, there's the medical facet, there's treating children, there's doing skin cancer surgery, there's doing aesthetic surgery. It's a very, very, very broad area. So I think sometimes when you're young, people always ask you, "What are you going to be when you grow up?" Well, how do you know what you're going to be when you haven't done anything? And so I think one thing that women should keep in mind is that it's okay to try a number of different things. It's okay to change your mind. It's okay to decide this particular path is not for you. And so I think part of life is the exploration process. And that exploration process, like Hawa mentioned, is definitely, definitely tied to excellent, excellent mentors. And I'm very grateful for my mentors as well, especially Albert Kligman, who was probably my most important mentor. And of course, he was the father of Retin-A. And I think what's critical to women is, as women, we go through many different stages in our careers. There's a point in time where you get married, there's a point in time where you have a family, there's a point in time where your children grow up and leave the house. And women can have a career that also changes over time with each decade. And so I think personal growth is really to be encouraged. Finding, different career opportunities can be very, very invigorating. But I do think there is one thing I would say to caution women is that as a woman, you can have it all, but not at the same time. And so I think women, instead of looking at getting into a career and I'm going to do this for the next 35 years, I think women should look at their year in decades, 10-year segments, and see how life fits into those 10-year segments and reevaluate, because I've changed careers or done something different every 10 years. And I think that's one of the reasons why I still love my career. Dermatology allows you to do that because of the many facets I mentioned previously. And I think it's really important in a career to have personal growth. And that personal growth can come by setting different goals in your life every decade.
I couldn't agree more. I think it's about being challenged all the time that keeps you immersed and interested. And always, I think for me, coming from education space, it's lifelong continuous learning, right? Staying curious, as Awa said, and being open to having it be fluid. As you mentioned earlier, it's really about staying open to the fact that your career might change over time and just continuing to believe that you will find the right path. So I think that's going to be a very valuable message to everyone who's listening to this podcast, because I think it is daunting when someone does ask you, like, what do you want to be when you grow up? And you can be many things when you grow up, and you can evolve as well. So that's a great message. So thank you both for being a part of our Hear From Her podcast series. And I think that this episode is going to be important to not only getting people excited about the field of dermatology, but teaching them about different career paths in dermatology, from industry to research to medical practice. And hopefully, this is going to resonate with some of our younger listeners who are thinking about exploring a path in this space. So, thank you both again. It was a pleasure to have this interview.
Thank you.
Thank you.
To our listeners around the world, thanks for joining us today. Tune in as we continue our journey to amplify the voices of women leaders in healthcare. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next time, remember to lift as you rise.